Good morning. My name is Janice Brown, and I'm a social worker, retired. And I just want to be very honest and truthful with this video. I started doing this the first time was when I saw was it Mr. Floyd, Dr. Mal?
Yeah, that was the one.
And it was very upsetting to see him in a chokehold and for the police officer there to have, I say the word, murdered him because it was just very disturbing. But since that time, I've been very, very upset again watching the news with black on black crime. And I say that about the drug addicts who in the neighborhood, people who cannot go outside, cannot sit on their porch without being murdered. I mean, bullets are coming in people's homes, and it is a critical situation. And I thought about ways what I could do to intervene. Every citizen has to help. And when I say help, I mean if you live in that neighborhood, you need to be walking your neighborhood with your minister or and with the police as a backup, going through the neighborhood and just attacking what's going on in your neighborhood. This is where you live, and you cannot have this in your neighborhood. Dr. Mal, would you like to elaborate on that a little bit?
Yes, I think that something has to be done to help the community. If the community participates more and gets involved in stopping the violence. I mean, there were programs in the past when Chaka Fatah had the House of Emoja where they got the gang members off the streets. So any kind of program to help stop the violence is very good.
Okay, and one of the ways it could be done is with the community and the police walking hand in hand. And I saw on the news that this is happening, but more of it needs to happen. The police needs to escort anybody in the community that wants to walk and show what they call a show of force. And when you show a show of force, we'll get rid of those drug addicts in our neighborhood, and we'll be able to take our neighborhoods back. Dr. Miles, you said you wanted to talk about something else?
Yes, I think what's good to know is there's many disorders, autism, mental health, where if the police and other people understand what they're seeing, we can probably intervene in a more effective way.
And what I wanted to say, there was a case recently on TV where the man was flailing a knife, and the police officer said it was justified that he killed him, he shot him. But what else could have been done with him wielding a knife? When the police arrived, he was in his car, he could have called for help. That's one of the problems. I feel that the police do not have the right tools to use. They don't have the mental teaching or mental illness on how to handle a situation. And most of the situations they handle are domestic violence and a lot of mental health cases. So I want to turn over to Dr. Miles. So she's an expertise. She's a psychologist. She's been dealing with mental health for many years. And I'm going to let her talk about those issues a little bit.
Well, I think if you can get information from the family about anyone who is having issues in the community, who may have issues, the case of the young man with the knife, and we don't know everything about it maybe at this point, but maybe a family member could have spoken to him. First of all, always start with somebody he's familiar with who he might like. Maybe a family member could be helped to ask him to put the knife down. Then you have some leverage. The other thing is that a lot of people that are seen in these crises need to be taken for evaluation at psych hospitals. That would be the other thing to do. Get the people to the psych hospital. Just transport them if you can. Obviously, there may be some issues in trying to transport. But when you're looking at people who may be acting out in the community, you're looking for how much of reality they have. Are they having hallucinations? Are they hearing something? Are they seeing something?
Are they delusional?
Yeah.
Yeah, auditory delusional. Are they thinking that?
There you go, Dr. Mallett.
Mm-hmm. Thank you.
She said you wanted the orange cheese. I had Italian.
Oh, that's okay.
But she said you like the orange. So
I appreciate it. Thank you very much. Okay, that's great. Thanks a lot, Anthony.
You're welcome.
Okay, I appreciate it. That's great. All right, thanks so much.
All right.
Thank you, Anthony.
We'll just continue. So, there might be something, they're feeling something, they're hearing something, they're touching something, and You just need to know what it is. If it's autism, they have they're not able to read social cues in autism, so they may not know exactly what's being said to them. And it depends if there's a intellectual disability, which used to be called mental retardation. Do they know what you're saying, or is there some?
And what's their mental capacity? Like they
Yeah.
might be a second year older. Their cognitive ability may be very declined. So you have to know all that before you come rushing in. A lot of times you rush in on a situation and they bring guns out, and that should be the last resort.
Exactly.
If we have more information, we can deal with it in a more intelligent way and not kill an innocent person. And the reason why I say innocent, I've dealt with special young men. I have them live in my home, and they don't mean harm,
Of
but they
course.
don't know any better. So you have to know how to handle it. And getting the education will help you to know how to handle these very horrendous situations. I mean, it's horrendous for the police. Somebody wielding a knife at them. What do you do? I mean, it's many options. You stay in your car. You don't get out and go to a situation where you put yourself in harm. That's number one
Right.
thing.
Always.
And always.
And before we end, we just wanted to say that we are available to train groups, classes, and we can help instruct people on how to de-escalate aggression, de-escalate violence, techniques for understanding different diagnoses. So signing off for Janice Brown, this is Dr. Jana Malice. Stay in touch, write your comments, and we are happy to help.